One of the things we use in our armamentarium to enhance our clients' and patients' good looks is dermal fillers. Dermal fillers are made of hyaluronic acid, which is a non-animal derived product, and we use it to fill in lines, small wrinkles, depressions, or just to enhance certain areas of the face. Our client today is concerned about the nasolabial folds, which have become a bit more intense in the last few years, and some lines around the perioral area, and also a couple of lines in the glabella area. Today we're going to be using two products to solve her problems, and one of them is Teosyal Deep Lines, and the other one is Teosyal Global. The deep lines are going to be used in the nasolabial fold inside to bring it out a bit, and then we're going to continue with the global to reduce the lines further and to eradicate smaller lines around the mouth, and also to eradicate the lines in the glabella. To begin with, we need to make the process as comfortable as possible, so we apply some EMLA cream in the areas where we're going to be injecting, but on top of that I'm going to be using some dental anesthetic inside the mouth to make it completely pain-free. Just cleanse the surface. So one of the things that we make sure before we inject is that the skin that we're going to be injecting is clear of any bacteria, and we do that by applying chlorhexidine wash to the area and making sure it's all very clean before we start. That's okay. The first material that we use is the deep lines, Teosyal Deep Lines, which is more highly cross-linked, dense material, and we use that in deeper folds because it'll have a much better effect of bringing out and lifting those areas. Now the deep lines we're going to be using in this area inside the nasolabial folds because it'll give us a bit of structure and bring out the fold, and then the global action we'll use around this area to reduce these lines, and we'll use a little bit on this line here just to bring it up a bit. We literally inject the material inside the folds and inside the depressions, thereby bringing the surface of the skin forward and outward to soften, not necessarily eradicate those folds, because that would change the shape of the face. We don't want to do that. We want to enhance the face and make it look better, not different. And I think that's very important. That's come out nicely. Once we place the material under the skin by injecting it, one thing we have to do is make sure that material is nicely spread out. It's not lumpy. And we do that by gently rolling it out so that it's nice and smooth and doesn't look unnatural. Like everything else that we do in this clinic, we try to create an enhanced version of you where the less we do is more. The mirror, you can have a look now. Nice,
very
isn't it?
Good, yes.
Very good, isn't it?
Yeah.
Already see how that's softened that tip there.
Yeah.
The second material, the global, is less closely linked, which allows it to spread more and to soften the appearance of lines in a much better way. Very nice. Very good. Now, a tiny little line here. One of the areas that we're going to be injecting today is the upper lip area, and we're doing that to eradicate some fine lines that we have above the upper lip, but also what I'm going to be doing is I'm going to be enhancing the philtrum of the lip and the vermilion border, which gives what we call the Cupid's bow to the top lip, is a characteristic of youthful lips. So young people have it naturally. What we do here is we try to enhance the lip to look more like a youthful lip. Once the procedure is finished, then we can apply Iredale pure minerals on it to allow the patient to get on with their lives without any evidence of the treatment they just had. We believe in people looking natural. We believe that you want to look the best you can in the most natural way. And that is absolutely lovely. Very Very good. We don't want to change the appearance that you have, we want to enhance it. And we find that if we do it in a very subtle way, it looks so much better. Have a good look at it now.
Fabulous.
Nice, isn't it?
Yes.